Welcome everybody. Now I would like to welcome Dr. Marty Krepcho to give us a talk on various psychological issues faced by the refugees during their transition phase. Let me introduce Marty. Marty is very well known to me. He was my mentor when I was a resident at Phoenix Baptist Hospital. Is the Director of Behavioral Health Services of Family Medicine Residential Center at Phoenix Baptist Hospital. Apart from that, he has been in his profession for 15 years in counseling, so he has a very good knowledge of the subject. So I would like to invite Marty and talk on this. Thank you.
Perna has to move the microphone down. I have to move the microphone. It might be easier if I hold it. Oh. It's an honor to be here today, truly an honor. And the other evening when Perna had asked me to send him my resume so he could introduce me, I told him that I would just like him to say that I am the Director of Behavioral Medicine at Phoenix Baptist Hospital. And I knew that he would not tell you what I really wanted to say in my resume. One of my most privileged moments in my resume since I have been in Phoenix is to have had the honor to hire and to train Dr. Chetri. Truly an honor, and to have known his wife and his son and daughter and to see them grow. I can't take any credit for that, but I will say in my resume, one of the best decisions I had ever made in the last 8 years was to invite him to train as a physician in this country and to use what he had learned and practiced as a surgeon in the refugee camps in Nepal. So that is my only claim to fame today, is that he has allowed me to step into his life. I also, he had asked me to talk about somewhat of an epidemic of suicide in the community, and some of the ways that as a community organization and other organizations might be able to put a little bit of a dent into that rate of suicide and depression among refugees. I can't say that in my own family that I've experienced that, but my wife and I have had the privilege to have adopted 2 children from South America. Our children were 8 and 11 when they came to this country and could not speak a lick of English. We couldn't speak a lick of Spanish. They had become eligible to be adopted because of violence and murder in their own families. I can't say that my experience even touches the experience of most all of you in your community who have experienced torture, who've experienced the theft of your land, the theft of your homes, the theft of your own country. But I can tell you that some of the same things that I have experienced with my children growing up in this country may be similar to what I want to say to you today. One of the most important things, I think, for our community is to really try to teach mental health people like myself and other organizations what it truly means to feel discarded. To feel discarded by other people and discarded from your own home in your own country, that impact not only is momentarily shattering, but in the long run it changes how we think and how we approach life. For people who are displaced, that happens in a moment. But that displacement, taking you from one place, which is your home and your heritage, and where your family and your tradition is, and placing you here, has an impact on the whole rest of your life. How it impacts you is not only in your heart, but in the way you think. And that's what I've been doing for 38 years in psychology, is trying to help people understand that when something happens in our life over here, we have a great emotion and feeling over here. In the United States, I would tell you after 38 years, most of the people that I see are emotionally illiterate. Most of the people that I see that struggle with depression and anxiety and other mental health issues have not been able and have not been taught how to express their emotions. Now you could say, well, Dr. Krepcho or Marty, how could that ever happen? We all have lots of emotions. But very many times when I talk to my patients, I ask them how many emotions they have. They're either happy or sad. They're either angry or not angry. If they're a teenager, they're bored. But guess what? There are over 50 emotions that people experience in their life. And if we can only name 5 of them in our life, that can lead to depression. Because unless we get that emotion expressed to someone else, it stays here and gets stuck. It gets stuck here. And when emotions about being displaced or having trauma in your life, to have lived in the refugee camps, to have left families behind,